Joining us now is Dr. Ashish Jha, Dean of the Brown University School of Public Health. Dr. Jha, good morning to you. Thanks for joining us. There is growing concern over the pace of this vaccine rollout. Just over 2 million doses have been administered, but the goal was 20 million by the end of the year. Where is the breakdown in the distribution chain, and how does it get fixed?
Yeah, good morning. Thanks for having me on. We're a couple of days away from the end of the year. We're obviously not going to hit our 20 million target. The issue here in my mind is twofold. There's a little bit of getting the vaccines to states, but the biggest problem is getting the vaccines from the states into people's arms. There's a lot of steps, and there just hasn't been much planning. There hasn't been much investment, and we're starting to see departments of health that are really stretched, having to try to figure out how to get all these vaccines into people, and it's going much more slowly than I think the federal authorities thought it would.
So President-elect Biden has a plan to invoke the Defense Production Act that will supposedly help speed things along and deliver 100 million doses of the vaccine within 100 days. How much do you think that will help?
I think it's going to help. I think it's going to help a lot. Look, it's not just about the vaccine itself, right? It's the vials, the syringes, all the packaging. And we don't happen to have millions and millions of these things just lying around. So you do need to produce them. You need to make sure all of those are available. And while our manufacturers are great, I think having the government really partner with the manufacturers, make sure the resources are there, is going to be critical to getting this out there.
So Novavax is now starting phase 3 clinical trials. This will be the fifth vaccine now in the final stages of clinical trials here in the U.S. What do we know about this vaccine? How promising is it?
I'm pretty enthusiastic about this. Again, we'll see what the data says. It's a protein-based vaccine, so it's a little bit of a different technology. They've built that before for the flu vaccine, so it's not something that's completely new. And we'll see how it goes. And ultimately, the data will decide. But I am hopeful. And I mean, let's be honest here. We really need all the vaccines we can get. So if this ends up being helpful and useful, it'll be great to have in the marketplace.
Turning to a different subject here, officials have not yet found evidence of that new coronavirus variant that we saw believed to be more contagious in the UK here in the United States yet. But you have said yourself that our ability to conduct surveillance on these types of variants is not robust in our country. How confident are you that we actually have the ability to find, discover, and monitor these virus mutations and see if they're actually spreading in our communities?
In terms of ability, absolutely, we have it. We've got great technology. We've got great technology companies. We can do this. It's just that we haven't been. There hasn't been any real federal effort to try to monitor for these things. I think it's essential. We absolutely need to know if these variants are here, where they are, where they're spreading. We've got to deploy the technology we have. We really need federal leadership on this.
All right, something we'll have to watch in the future. Dr. Ashish Jha, thank you so much for your time this morning. We appreciate it.
Thank you.